So if you started a running plan as a New Year's resolution and now your Achilles heel is hurting, it might be something called Achilles Tendonitis. So I'm Blake Wallace, an orthopedic foot and ankle surgeon here at Plano Orthopedic Sports Medicine Center in Plano, Texas. So the Achilles tendon is the largest tendon in your body. It comes down and inserts on the heel bone. It's what helps propel you forward. And whenever you're running, you put an enormous amount of stress on that Achilles tendon, especially if you are what we call a forefoot striker, where you land on the ball of your foot. And so you're shock absorbing with that Achilles with every step. Achilles tendonitis tends to hurt about 5 centimeters or so from where your heel bone is. And that's because the blood supply kind of stinks in that area. It's pretty good coming from the top, pretty good coming from the bottom, but not very good right there. So there's an imbalance between you beating up on this tendon and your body's ability to heal it. So the best intervention that we have besides rest is something called eccentric strengthening and stretching exercises for your calf muscle. I'm going to show you what that is. So eccentric, most people don't know what that means, but it's the opposite of concentric. So if you're working a muscle concentrically, then if I'm doing like a bicep curl, a concentric is working while it's getting shorter. If it's eccentric, then it's working while it's getting longer. Okay, so an eccentric bicep curl is where you pull it up here and you slowly let it lower itself down. You keep it from slamming down. So if we're doing that on the calf, a concentric exercise is where you're down and you're raising yourself up. So the eccentric is the opposite of that. And that's how you get rid of Achilles tendonitis with the eccentric strengthening. So you can find a stool or just get on your steps at home or on the curb outside, and you want to help yourself up with both sides and then get onto the side that is affected. So I'm working on my right side here. I'm gonna lift my left side off the ground and very slowly lower yourself down and count to 10 while you do that. If it's really flared up, you're probably not gonna be able to go too deep. But once you start feeling that, then you help yourself back up with the other side and then slowly lower yourself down. Count to 10 and do that for about 10 reps 3 times a day. And that's gonna keep the doctors away.